Hey everyone, thanks for coming back. Thanks for watching. I have some updates. So if you've been following along, I was diagnosed with breast cancer, triple negative breast cancer, back in February of 2021. Today is June 1st, 2021, and I have some updates for you guys. So I thought I'd start with maybe some good news. I have a few updates for this week because a lot's going on and a lot is happening, but I thought it would be fun to start with some good news. So about a month ago, I got some blood work done and had a genetic test done. They screen 19 genes for common mutations that are associated with cancer. And I got the results back and they're all negative. So what that means is I don't show any mutations in my genes that would make it more likely to have a different kind of cancer, a reoccurrence of cancer. It's all negative. So that is wonderful news. I do have triple negative breast cancer, so there is a higher risk of reoccurrence with that type of breast cancer. But getting a negative on this genetic test just takes like one level of, worry away. So the odds aren't as fully stacked against me as they could have been. Now, it does say in here that based on your personal and family history, your current lifetime risk to the age of 80, which I plan on living longer than that, but for a second primary breast cancer is rated at 13.8%. And that's based on the model that they use with all my family history, my personal history, and this genetic testing to, give a percentage for possible second breast cancer. But, like I said, getting a negative on this test really brings the odds further down for me, which is excellent news. I'm super happy for that. So, yay, good news. The other update I have for you right at this moment is to fill you in on how things went with our second attempt at Taxol. So if you watched my previous video, you saw I had a severe allergic reaction on my first dosage of Taxol. We had planned to do weekly doses for 12 weeks, and within 5 minutes of starting my first dose, I got tightness in the breath, my chest. I couldn't, had difficulty breathing, fire face, all of that. So we had to stop. So the plan then was to try it again, but this time we were going to go with the 4 doses, and I know that sounds weird because it's a higher dose, but I would only be exposed to it 4 times opposed to every single week for 12 weeks. Also, we preloaded me with a whole bunch of medications. So starting 2 days prior to the scheduled time, I was taking oral medications, some steroids, as well as they would then, in the IV, fill me up with a whole bunch of steroids and antihistamines and all that kind of stuff to try and counteract or at least lessen the allergic reaction. So that was the plan that we had in place. Last week I went in to do this, and it was a long weekend here in Canada. So normally I'd have my treatments on Mondays. I went on the Tuesday. My appointment was at 12. Got into the chair around 1, and then they realized, oh wait, you're not doing weekly, you're doing the dense dose. We don't have enough time to do this treatment because it takes 4 hours to do. So after all of that, all of the steroids, getting up at 3 a.m. to take pills the night before, or I guess the morning of, they had to reschedule. They rescheduled to the next day, so I had to repeat again where taking the steroids at 9 p.m., 3 a.m., and then go back in. This time we got in, 8 a.m. IV went in first try, everything was going great. Time for Taxol, 5 minutes. That was it. Exact same reaction. For the first couple minutes, I'm like, I'm doing okay, and then I could just feel the clench in my chest, and I called out to my nurse, and she came over, and by that point my face was starting to go red, so they turned it off, and that was that. My doctor came in, and we were like, okay, well, you can't tolerate Taxol. Now, I had posed my situation to a Facebook group that I'm on for triple negative breast cancer, And I believe some people in the comments here on YouTube as well had some suggestions based on my last video with the allergic reaction, which sort of echoed what the Facebook people were saying as well. And they provided the names of some drugs that when they had allergic reactions to Taxol, because allergic reactions to Taxol are quite common. Most people can like get through it, but they have some form of reaction. Mine's just too severe to proceed with doing 4 hours of infusion. It's not 4 hours, it's like 3 hours, but with pre-meds 4. So I presented the names to her, and one of them was like, no, we can't do that one. That's not classified for, you know, your type of breast cancer or your type of cancer. But the second one, which I'm going to post the name of that drug down here because it's like Taxol or something like that. I'm not saying it right, but I'm going to post it down there so you can see. That one, she said, was a maybe. So they went back, did some research to see whether it would be effective, to see whether under Ontario's health program it would qualify. And she called me at the end of the day to say, yes, we can give this one a shot. It is in the same family as Taxol, so there is a strong possibility that I'll still have some form of reaction. I'm just hoping that it's not to the level where I can't tolerate it. So we're going to give that a shot. It is actually 3 doses, and there'll be 3 weeks in between each dose, so that's a little bit different. But if I can get through it, I will feel a lot better that, you know, I got through the whole protocol, because the whole point of chemo prior to surgery is not only to try and shrink your tumors, but also to kill rogue cancer cells that are floating around in your body. And, you know, triple negative breast cancer is a fast-growing cancer, so if there's some of that lingering around, there's the potential for it to explode into a new cancer. So I would feel better if I made it through the entire chemo process rather than just half of it. But we will see. So I'm heading into the hospital in a couple hours to give that a shot, and I will report back to you guys to let you know how it went. I'm hopeful. If it doesn't go well and I can't tolerate this drug either, then that's going to be the end of chemo for me. There's nothing else that is deemed usable for my breast cancer, so that is where I would then move on to surgery. So it's kind of a big day. It could be a deciding factor day. So a little nervous about that, but it'll be over soon. So I'm going to check back with you guys a little bit later, let you know how things went, update you on other things going on this week. I have an ultrasound booked on Friday. I probably won't have results to share with you, but maybe I can glean something from how the ultrasound went. Because as of right now, the one lump that I could normally feel, I haven't been able to feel it in over a week. So might actually be a little bit longer than that, where before it would come and go. I'd think it was gone, but then I'd feel it again. Now I just don't feel it. So hopefully the ultrasound will show that, you know, the first 4 chemo treatments that I did were effective, especially if this next drug is not going to work out and I have to move on to surgery. I'd like to go in there with the least amount of tumors as possible. So yeah, we'll see. Check back with you soon. So here we are about 2 weeks later. I know it's been a while, but a lot happened between now and when I recorded that previous segment about the genetic results coming in and the fact that I was about to head off to try the new drug Taxol instead of Taxol for my chemo treatment. So I went in, had the treatment. It was successful in that I did not have an allergic reaction. The nursing staff was great. They watched me like a hawk. Everything went in slowly to start to make sure I wasn't going to have a reaction to it. And yeah, it was actually pretty uneventful in, you know, comparison to the previous 2 times I tried and had those allergic reactions. So yeah, went pretty smoothly that way. So that was super exciting. I went home, had a nap, slept for a couple hours, and the next day I was feeling pretty good. Was pretty excited that we found something that seemed to be working and that we had an option to keep moving forward with chemo. So that was pretty exciting. And then the side effects started, and that was less exciting. The first bit was I ended up with some really bad diarrhea, and I ended up having to call an after-hours oncology nurse and to get some help because it was getting pretty bad. So my husband dashed out to Shoppers Drug Mart at like 11 at night, came back with some Gatorade and some Imodium, and that combination seemed to help out. So that problem was solved, but was not fun. Then the next morning the pain started, which they warned me that part of the side effects of Taxotere, as same with Taxol as well, is bone pain, muscle pain, joint pain, that kind of stuff. So I was warned, but I was definitely not prepared for the level of pain that I was actually feeling. Thankfully, I was able to get a prescription picked up for Tylenol 3 because just regular Tylenol was not touching this. Though I do know now that I was under medicating myself with the Tylenol 3, and that was not helpful to my recovery. So I definitely need to be more aware of that and less reluctant to be taking Tylenol 3s when I was in pain, because this was kind of next level. As I said, I was definitely warned that it could happen, but I was not expecting it to be to that level. There's definitely times in there where I found myself wishing that I actually was allergic to the drug and that we just didn't have to do it, because I couldn't even fathom having to go through this again 2 more times. So yeah, that was not great. I also developed some really severe heartburn. So it just basically felt like a vice was crushing my chest, and then the mouth sores started. My tongue turned all weird and got these like weird ridges and stuff. I took a picture, but I'm not sure if it really captures the what exactly was going on there. So the pain, the heartburn, the mouth, eating was very difficult. So I was not eating much. What I was eating would be like, some overcooked pasta, mushy stuff. But eating just in general was not of interest to me because it made the heartburn worse. It made my mouth hurt. So yeah, there was a good chunk of time there. I, for once in my life, actually lost my appetite. I do like my food and I do like my large portions. So for me not to just even be interested in eating was unlike me. So yeah, the side effects were pretty brutal on this. It started to turn around where I was just doing like a regular Tylenol with some Advil, and I was still in pain, but it was starting to get a little bit better. And then I went in and got my second dose of the COVID-19 vaccine, and the next day my pain shot right back up. Pretty bad. I was having some major like chills. It like I couldn't stop shaking. Had to wrap myself in blankets with a heating pad in order to try and counteract the chills. I did take 2 Tylenol 3s that morning, which helped a little bit, but it wasn't. It didn't take the pain away. It just helped me sleep more so throughout the day. I think I slept for half an hour, woke up, slept for half an hour, woke up, slept for half an hour, woke up. And then by the evening, realized that I was running a fever. So obviously one of the side effects of the second dose of the vaccine is fever. So I knew it was probably because of that, but at the time my thermometer was coming in at 39.2 Celsius, which is pretty high. So I called the after hours oncology nurse, and she did recommend that, even though it's probably because of the vaccine, to still go into the ER just in case there was something underlying. So spent the next 4+ hours in the ER getting worked up, blood work, did blood cultures. They did an EKG because of my heartburn and the fact that my heart rate was elevated. But I assured them my heart rate was elevated because I was in pain, because I didn't take any more Tylenol 3, because I didn't want to mask the fever in case it was something more than just the vaccine. So that's why my heart rate was up. They did a chest x-ray to make sure that there was no pneumonia going on. So they were very thorough to confirm that it was because of the vaccine and not because of any other underlying infection or anything. I am at a point in my, I was at a point after my chemo treatment that, very highly susceptible to infection. Always highly susceptible to infection when you're on chemotherapy, but especially at a week after your chemo, you're in a pretty vulnerable state. So they were very thorough in making sure that everything was fine. So they got my fever down. They confirmed with all the tests that everything was good and was able to go home. And I woke up the next day and it was like night and day. I found a level of relief that I wasn't sure was coming. The pain just it didn't disappear. I was still in discomfort, but I'd call it more like stiff and achy than I'm shaking because I'm in so much pain that I had been experiencing before. And every day since then has been, which has only been a few days, but has been a lot better. Haven't had to take any, not even a regular Tylenol or Advil or anything. So came out on the other side, and maybe if I hadn't gotten the vaccine when I did, I wouldn't have had that reoccurrence. I mean, obviously I wouldn't have ended up in the ER, but I think that maybe I would have been feeling a little bit better sooner, if I hadn't gotten the vaccine. Maybe would have been feeling better sooner if I hadn't under-medicated myself and actually gave myself a little bit of relief. So lesson learnt on that. Some of the other side effects that I'm experiencing and that are still ongoing right now are, like I said, I still have stiffness and achiness, but I've also had experiencing weakness in my legs and hands, and also numbness. So I have parts of my feet and toes that feel kind of numb, and my fingertips have lost some feeling to it. I can still feel them, but they are definitely on the number side. A few days ago I spilt some boiling water on one of my fingers, and though I registered that it was hot, it wasn't I just burned myself. And I had to be oh yes, I should probably put this under cold water. So definitely need to be a little bit more careful right now. Also dropping a lot of things because my hands are very stiff and my fingertips are numb. So that's one of the other side effects that's going on, and I'm hoping will go away. There is a chance that it could last for months, years, or never go away. But I'm hoping that it goes away, and I'm hoping that it doesn't get worse as the treatments go along. But I'll definitely be reporting that to my doctor. So yeah, pretty crappy few weeks following the treatment, which is why I wasn't able to record anything. I mean, I don't mind sharing my experiences with you guys, but I don't think you wanted to actually see that happening. Got one little bit left to share with you. Update. A while back I mentioned that my doctor had ordered an ultrasound for me. It took a little while to get the appointment, but I had the appointment on June 4th. So that was fun because that was the start of the pain days. But made it through, did the ultrasound, waiting for results. Then I get a phone call from the hospital a few days ago, and they asked if I could come back in to do another ultrasound. The radiologist wanted to repeat it because there were some parts of it, I guess, that were unclear or didn't give them the full picture or something like that. So they had me come back in. I went in on this past Friday, so that was a couple days ago, and redid the entire ultrasound. I thought it was just going to be like, here, we just need to see this spot, but no, it was like, let's do the entire thing all over again. Again, super thorough. So it took over an hour to do the ultrasound, and then they had me wait there so that the radiologist could look at it and make sure that she had what she needed before sending me home, just in case they needed to see something else, which they did. So the technician came back, did some more scans, and then the radiologist came in and she looked at some of the stuff live as the radiologist assessed everything to make sure that she had everything. But the cool thing was, because the radiologist came into the room, I was able to talk with her. And normally, you know, you would get your scans done, radiologist would look at it, do a report, the report goes to your doctor calls you in, you get the results from your doctor. But the radiologist was there, and she was super nice to let me know that from the comparison of what they did that day and the one back in January, the masses have definitely started to shrink. So that is fantastic news. I don't have details yet. Like, I'll see when I get the report, I'll know that. But so I don't know if all of them have been shrinking, or if some of them have been shrinking, or how much they have gotten smaller. But when it comes down to it, just the news of it's working. Something's happening. So, and it's in the good way, not, you know, I guess worst case would have been like, there's more of it, rather than, you know, it hasn't changed, but, you know, finding out that it's actually, this is working and it's worth it, especially after such a really hard week with all the side effects and everything, and knowing that I have to do that 2 more times, it in some way makes it a little bit easier to go into that, knowing that that stuff is working. I mean, I guess technically it could be the first 4 treatments that made it work, and that this stuff does nothing, but maybe it is. So anyways, ending on some good news there, that stuff is progressing, and hopefully when we finish all of the chemo in July and do more scans, maybe it will all be gone. So that's what we're working towards, that's what we're hoping for, and we'll see in, you know, a month and a half. Anyways, I'm going to end this video here, end it on a positive, happy note. Got a lot of good news with the genetic results, the ultrasound, so it's all coming together. Anyways, thank you for watching. I will check back with you guys soon, but I am definitely looking forward to a nice quiet week. This week I have no tests, I have no treatments. I'm looking forward to a nice, quiet, relaxing week before we do this all again. Thanks again for watching, and I will see you next time.